On this episode of The Soul of Black Maternal Health, maternal mental health is not just emotional wellness. It is a major public health concern impacting mothers nationwide and right here in Washington state. According to CDC data, approximately 1 in 5 mothers in the U.S., about 20%, experience a maternal mental health condition, including postpartum depression, anxiety, or trauma-related disorders. But what the data also shows is that up to 75% of maternal mental health conditions go untreated, often due to lack of screening, stigma, or limited access to care. Maternal mortality review findings across the U.S. also show that mental health conditions, including suicide and substance-related deaths, are increasingly recognized as leading contributors to pregnancy-related deaths within the first year postpartum in several states, including Washington. In Washington state, specifically, public health data estimates that around 20% of new and expectant parents experience perinatal mood and anxiety disorders, yet many never receive treatment or follow-up care. And in communities like Spokane and the broader Eastern Washington region, access gaps remain even more visible, where families often rely on limited perinatal mental health resources, crisis hotlines, or regional support programs to fill the care gap between OB visits and behavioral health services. Today, we explore postpartum depression, anxiety, trauma, and what healing looks like when care, community, and conversations come together as we speak, observe, understand, and lead the way toward healing the whole mother. Welcome to a special podcast series created in honor of Black Maternal Health Week, hosted by the Shades of Motherhood Network. I'm Dr. Akisi McMillan, integrative women's health expert. This week and this series exists to center the voices, leadership, and lived experiences of Black mothers while advancing community-led solutions that promote healing, trust, and collaboration. Across the United States, Black women continue to face significant disparities in maternal health outcomes. And while these disparities are real and urgent, so too is the strength within our communities where we hold powerful traditions of resilience, advocacy, and collective care. That is why this year's theme centers around the SOUL framework: speak, observe, understand, and lead. These conversations are about awareness, it's about empowerment, and it's about change. Let's begin. Maternal mental health is one of the most underdiagnosed and undertreated areas in maternal care, both nationally and here in Washington state. The CDC estimates that 1 in 5 mothers experience a diagnosable mental health condition during pregnancy or within the first year postpartum, but that number only reflects what is diagnosed, not what is experienced in silence. National research shows that up to 75% of women with maternal mental health conditions never receive treatment, which means the majority of affected mothers are navigating recovery without clinical support. In Washington state, maternal mental health reports and public health initiatives consistently identify perinatal mood and anxiety disorders as a priority concern, especially given that more than 83,000 babies are born annually in the state, making maternal mental health a large-scale population health issue. And when we look at maternal mortality review findings, we see something even more urgent. Behavioral health conditions, including mental health crises, substance abuse, and suicide, are among the most frequently identified contributing factors in pregnancy-related deaths in Washington state in recent years. This means maternal mental health is not separate from maternal mortality conversations. It is a part of them. And yet, despite this, Black mothers continue to experience lower rates of screening, lower rates of diagnosis, and lower rates of access to culturally responsive care, even when stress exposure is higher. This creates a gap, not in need, but in care. Speak. Maternal mental health includes postpartum depression, postpartum anxiety disorders, post-traumatic stress disorders related to birth trauma, and perinatal mood and anxiety disorders. CDC and National Institute of Health data show these conditions typically emerge within weeks to months after birth, but without screening, they can go unrecognized well into the first postpartum year. In Washington state, public health agencies emphasize that perinatal mood disorders are common enough that they are considered a routine maternal health priority, not a rare complication. However, recognition alone does not guarantee treatment access. Observe. Warning signs include persistent sadness lasting more than 2 weeks, withdrawal from family, friends, or baby, intrusive thoughts or fear-based thinking, panic episodes or extreme anxiety, emotional numbness or disconnection, difficulty bonding with the newborn. In Washington state, maternal health resources, including regional public health systems like Spokane area support programs, one of the most emphasized concerns is delayed recognition and delayed help seeking, often due to stigma, lack of awareness, or limited access to providers. And here's what research consistently shows. When maternal mental health symptoms are not identified early, severity increases, recovery time lengthens, and risk of crisis escalates. Understand. Maternal mental health conditions are shaped by multiple overlapping factors: hormonal changes after birth, severe sleep deprivation, history of trauma or anxiety, lack of partner or family support, chronic stress exposure, including racial stress and socioeconomic stress. The National Institute of Health research confirms that early intervention significantly improves outcomes, reducing severity and long-term impact. But in Washington state, like many other parts of the country, access to care is uneven. State reports highlight ongoing disparities in maternal care access based on geography, income, and race, with the rural and eastern Washington communities often experiencing fewer perinatal mental health providers and longer wait times for behavioral health services. This means geography can directly shape mental health outcomes. Lead. Leadership in maternal mental health means building systems of care where gaps currently exist. It includes routine maternal mental health screening during pregnancy and postpartum, expanding access to behavioral health services in rural and underserved areas, normalizing therapy, counseling, and peer support, creating culturally responsive maternal health spaces. In Washington state, policy efforts have already begun expanding perinatal coverage and behavioral health access, including extended postpartum coverage through Medicaid programs aimed at improving maternal outcomes. But leadership does not only happen at the policy level. It also happens in community spaces where organizations like Shades of Motherhood Network create trust-based environments where mothers can speak openly, be heard, and be supported without stigma. And in communities like Spokane, that community layer is often the difference between isolation and support. Speak, observe, understand, lead. When we understand the data, we understand the urgency. When we understand the urgency, we stop normalizing silence. And when we stop normalizing silence, we start building systems where mothers are not only surviving, but supported, seen, and cared for. Because maternal mental health is not separate from maternal health. It is the foundation of it. For more information on Black maternal health, visit the Shades of Motherhood Network at theshadesofmotherhoodnetwork.org.